Public Health Conversations, hosted by Evon Cherry.
Hello, my name is Evon Cherry, and my show today is about medication for COVID-19. Let's talk about molnupiravir. It's manufactured by Merck Pharmaceuticals. It has a brand name also of lagevrio. Molnupiravir is Merck's, and it has the green light from the Food and Drug Administration to use this pill for both the Merck and Pfizer to provide emergency health care for COVID-19, especially a preventive care to have to not go to the hospital but remain home is one of the goals. Because information and studies on COVID-19 changes rapidly, we also encourage everyone to take the time to visit the websites for the Center for Disease Control and Prevention, the World Health Organization, and your state and local government for new updates. This pill has a generic name, I said, like lagevrio. It has an imprint 82 on it. It comes in a strength of 200 milligrams. The color is orange. The availability is prescription only. It's a miscellaneous antiviral pill, and it's not a controlled drug, but the supplier, again, labeler is Merck. So I'm going to talk about 9 things that you need to know about this molnupiravir, the new COVID-19 pill. Number 1, how Merck's COVID-19 pill molnupiravir works. Taken only after diagnosed with the COVID-19 symptoms, it's administered 4 capsules twice a day for 5 days, starting within the 5th day after the first symptom. When medication enters the bloodstream, it blocks the ability of severe acute respiratory syndrome, coronavirus 2, to replicate. Dr. Shah explains. Dr. Shah is a medical PhD at Yale medicine infectious disease specialist. The virus uses ribonylnic acid, RNA, as its genetic material. The structure of the medication resembles the nucleosis. That's the chemical building blocks used to make the virus, is RNA. The drug works by incorporating itself into the RNA as it is being synthesized, thus causing many mutations or changes introduced into the viral RNA genetic code. So when the RNA is translated into viral proteins, the proteins contain too many mutations for the virus to function, which is what we want to do. Does molnupiravir have side effects? Of course, there are possible side effects, which include diarrhea, dizziness, or nausea. Is molnupiravir similar to Tamiflu? That's an antiviral medication that was used to treat the flu. It's similar in function, use, and availability, but molnupiravir targets the reproduction of viral RNA. Does molnupiravir prevent infection or severe illness and death? The Merck pill is designed to prevent the serious illness of COVID-19 and to keep people out of the hospital. Normally, these people have only one risk factor. Who is molnupiravir recommended for? The treatment of mild to moderate COVID-19 in adults 18 and older who may become high risk, hospitalized, or near death. It is not authorized to be administered to children younger than 18 because of the damage that it would affect the bones and the cartilage growth. Will molnupiravir work on virus variants, including the Delta and Omicron? Clinical trials have been conducted in the US and other countries, so the CDC suggests the Delta variant agrees with the study, but a study is still in progress for the Omicron. But there's an updated booster shot suspected within days as CDC signs off on it. That's to come. Could molnupiravir be a turning point for other COVID-19 treatments? Thus far, there is not many medicines available, and remdesivir, approved by FDA, can only be administered intravenously within the hospitals. Also, only for children 12 years of age plus. But in the cases of severe symptoms, the medicine may provide moderate benefits. The Merck and Pfizer pills are the first that can be taken at home if caught early enough to prevent hospitalization. Should pregnant women use molnupiravir? The medication is not recommended for mothers. Studies reveal that medicine may cause fetal harm. It is not recommended for breastfeeding as well. Parents who may reproduce should consider contraceptives in the duration of treatment. For women, there is an additional 4 days after the final treatment to remain on contraceptives. For men, they are advised to use contraceptives for approximately 3 months after the last dose of molnupiravir. More side effects can be found on the FDA website. With molnupiravir authorized, do we still need vaccines? Vaccinations, testing, masking, and forms of prevention are key even when other drugs become available. Timely vaccinations, early testing, and consulting your healthcare provider. It is encouraged to take a test even if you think it's just a cold or allergies. Home testing is part of preventive measures. Even though molnupiravir is a high efficiency, it is not perfect. Virus can mutate and develop resistance to antiviral medications. No medication is perfect, but for many high-risk patients, molnupiravir can really reduce the risk that we face daily. Continued, do we still need vaccines? Yes, vaccines remain essential to give one a greater chance of survival and slowing the spread. It has been said that people who get vaccinated have a much lower chance of getting sick and in need of treatment. The vaccine is said to be our first line of defense in preventing hospitalization. Some people might say, I'm not getting vaccinated because I have access to these medications, to this pill, or to remdesivir, or other treatments, but you can't trade one for the other. If you haven't done so already, the most important thing is still to get the vaccine. Dr. Meyer is an associate professor of medicine, infectious disease with the Yale University, and specializes in HIV in incarcerated women. Both Dr. Shah and Dr. Myers are in agreement with the aforementioned. The next medication is Paxlovid, and it's manufactured by Pfizer Pharmaceuticals. Paxlovid has two brand names, nirmatrelvir, let me spell that for you, NIRMATRELVIR, and another name is ritonavir, RITONAVIR. It has an imprint of PFE3CL, and it comes in the strength of 150 milligrams. It's a pink pill, it's oval, and it's prescription only, and the drug class is antiviral combination, and it's not a controlled drug. Paxlovid or ritonavir, it comes in 100 milligrams, and it has a marking imprint of a capital N, capital K, and it has a strength of 100 milligrams, and there is a reason for this strength being 100 because this medication, along with the other, can be adjusted, and it's available by prescription only. So 13 things to know about Paxlovid, the latest COVID-19 pill. How Pfizer's COVID-19 Paxlovid nirmatrelvir works. It's an antiviral therapy that consists of 2 separate medications packaged together. First, a 3-pill dose, which would be 2 pills, that would be the nirmatrelvir, which inhibits a key enzyme the virus requires to make functional virus particles. After the treatment, the COVID virus released from the cells are no longer able to enter the uninfected cells. This in turn stops the infection. The other pill is ritonavir that was once used to treat HIV and AIDS, but is used to boost levels of antiviral medicines. It actually shuts down nirmatrelvir's metabolism in the liver to remain in the body to work longer, giving nirmatrelvir a boost. When should I take Paxlovid? Take Paxlovid within 5 days of developing the symptoms onset, says Jeffrey Topal, MD. So Jeffrey, he's a Yale medicine infectious disease specialist, and he's involved in determining COVID-19 treatment protocols for his Yale New Haven hospital patients. How often do I take Paxlovid? Take Paxlovid pills 2 times daily for 5 days with a full course equaling up to 30 pills. It is helpful that the pills are packaged in a dose card medication blister pack that allows you to punch out the pills as needed and keeping accurate with the day. If Paxlovid is similar to Tamiflu, that's an antiviral medication that treats the flu. It is similar in function and use and availability by prescription and to be given early in the illness. I think it's a good comparison, says Dr. Roberts. Scott Roberts, MD, is a Yale infectious disease specialist who cares for hospitalized patients at Yale New Haven's hospital. How well does Paxlovid work? After the Food and Drug Administration authorization, Pfizer presented clinical trial data conducted mid-July and early December of 2021. The data showed that vaccinated participants who were given Paxlovid were 89% less likely to develop severe illness and death compared to the trial participants who received the placebo. These participants were later given Paxlovid within 5 days of the symptoms onset at 3 days. The drug's effectiveness is continuously studied. What do we need to know about Paxlovid? How it works in kids. Pfizer launched a clinical trial in March to study the safety and efficacy of Paxlovid in children and teenagers ages 6 to 17 and who had the COVID-19 symptoms and tested positive for the virus, but were not hospitalized, nor were they severely sick. It was decided that while Paxlovid is authorized for use in adolescents and teenagers ages 12 and up, they must weigh 88 pounds, and that's considered to be adult weight. The FDA has allowed extensions of emergency use authorization for medications such as monoclonal antibodies and remdesivir in young age groups. What do we know about how Paxlovid works in kids? Continued, largely because the difference in metabolism and excretion, liver and kidney functions specifically, of the drugs in this group are thought to be similar to that of adults, agreed Dr. Topal. Can anyone get a Paxlovid prescription? The FDA authorized Paxlovid for people ages 12 and older who weigh at least 88 pounds, and they must have also tested positive for COVID-19 and be a high risk for developing severe COVID-19. Severities are people with underlying conditions, including cancer, diabetes, obesity, and other issues, or be 65 and older. More than 81% of the COVID-19 deaths occurred in this group, according to the CDC findings. If pregnant or breastfeeding or can become pregnant, the FDA recommends discussing your options with your healthcare provider. It is important to know that even though the healthcare provider can write a prescription, your pharmacist must be provided a list of medications that you are currently taking and blood test results from at least the last 12 months to provide one with Paxlovid, or it may be prescribed for certain limits, with certain limits. The adjustment because of your medication. Does Paxlovid work against Omicron? Paxlovid's clinical trials took place before Omicron, and later subvariants like the BA.5 became predominant. The studies are being conducted but have not yet been published in peer-reviewed medical journals. What are the side effects from Paxlovid? Paxlovid is usually very well tolerated, explains Dr. Roberts, but people should stop taking Paxlovid and call their healthcare provider right away if they experience any of the following signs of an allergic reaction. That would be hives, including swallowing or breathing, swelling of the mouth, lips, or face, throat tightness, hoarseness, or skin rash. Other possible side effects include an altered or impaired sense of taste, diarrhea, increased blood pressure, muscle aches, abdominal pains, nausea, and feeling generally unwell. Since Paxlovid is cleared by the kidneys, dose adjustments may be required for patients with mild to moderate kidney disease, explained Dr. Topal. For patients with severe liver damage, Paxlovid is not recommended. The levels of the drug can become too high and could cause increased side effects. Can I take Paxlovid if I'm taking other medications? There is a long list of medications Paxlovid may interact with, or the doctor may not prescribe Paxlovid because these interactions may cause serious complications. You may want to do research and ask your pharmacist for a printout of the list of medications that interact with Paxlovid. The list of Paxlovid interactions which includes some organ anti-rejection drugs that transplant patients take, as well as common drugs like some that used to treat heart arrhythmias. Paxlovid also decreases the metabolism of anticoagulants, blood thinners, that many older adults depend upon. It can drive up levels of those medications in the body to an unsafe level. Also, Paxlovid interacts with cholesterol-lowering medications like Lipitor, but that's nothing bad, and it's less challenging for a patient to overcome because not taking Lipitor for 5 days is nothing bad is going to happen from that one. What is the rebound effect of Paxlovid? There have been reports of a rebound of COVID-19 symptoms in some people within 2 to 8 days after completing the 5-day course of Paxlovid. In those cases, some have tested positive again but have no symptoms, and others have a recurrence of symptoms. Pfizer stated that in clinical trials for Paxlovid, several participants appeared to have a rebound in virus levels, and the same occurrence in some people who were given the placebos. Scientists are still studying the Paxlovid rebound. The CDC states a rebound does not mean a person is resistant to Paxlovid, nor does it mean that they are reinfected with the virus. A brief return of symptoms may be part of the natural history of SARS-CoV-19 infections in some people, independent of treatment with Paxlovid, adding there's no evidence additional treatment is necessary. Note, asymptomatic means producing or showing no symptoms is a term I decided to add because many have heard it used and it is not the same as rebound. If I'm not eligible for Paxlovid, is there something else I can take? There are other therapies for COVID-19, and anyone who cannot take Paxlovid should talk to their doctor about the best approach, possibly due to interactions with medications one is currently taking. Do I still need to be up to date on vaccinations if Paxlovid is available? Vaccination, testing, masking, and all forms of prevention are key even when other drugs do become available. Timely vaccinations, early testing, and consulting your healthcare provider. It is encouraged to take a test even if you think it's just a cold or allergies. Home testing is part of preventive measures. Even though Paxlovid has a high efficiency, it is not perfect. Viruses can mutate and develop resistance to antiviral medications. No medication is perfect, but for many high-risk patients, Paxlovid can really reduce the risk of severities and possibly death. We still need vaccines. Vaccines remain essential to give one a greater chance of survival and slowing the spread. It has been said that people who get vaccinated have a much lower chance of getting sick and in need of treatment. The vaccine is said to be our first line of defense in preventing hospitalization. Some people might say, I'm not getting vaccinated because I have access to these medications, to this pill or to remdesivir or other treatments, but you can't trade one for the other. If you haven't done so already, the most important thing is still to get the vaccine. Dr. Meyer, the Associate Professor of Medicine and Infectious Disease Specialist, he specializes in HIV and incarcerated women. Both Dr. Shaw and Dr. Meyer are in agreement with the aforementioned. Get vaccinated. SHARE. SHARE basically has to do with public health and viruses. SHARE. Share the reason why a COVID-19 vaccine is right for the patient, given his or her age, health status, lifestyle, occupation, and other risk factors. Highlight positive experiences with COVID-19 vaccines, personal or in your own practice, as appropriate to reinforce the benefits and strengthen confidence in the COVID-19 vaccination. Address potential questions and any concerns about COVID-19 vaccines, including side effects, safety, and vaccines effectiveness in plain and understandable language for everyone to understand. Remind patients that COVID-19 vaccines help protect them and their loved ones from serious COVID-19 illnesses and complications that can result in hospitalization and even death in some people. Explain the potential cost of getting COVID-19, including potential serious health effects for the patient, time loss, such as missing work or family obligations, financial costs, and particularly spreading COVID-19 to more vulnerable family members or friends. I am Evon Cherry, and I thank you for listening to my update on medication as it relates to COVID-19.
This has been Public Health Conversations with Evon Cherry. If you'd like to leave suggestions, email us at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.